And now they're saving America from the deadly opioid epidemic. There are more than 33,000 opioid-related deaths every year, according to the CDC. But a new government-sponsored study shows Vivitrol, a non-narcotic, is the first drug that works just as well as a narcotic for opioid dependence treatment. Joining us right now in a Fox Business exclusive is the chairman and CEO of Alkermes. He is Richard Pops. Richard, good to see you. Thanks so much for joining us. Congratulations on this breakthrough. First off, we were just talking during the commercial break. You said 60,000 people will die this year from opioid.
That's right.
Characterize the crisis.
Well, this is an epidemic of unprecedented proportions in this country, dwarfing other medical conditions in terms of the severity, not just for patients, but their families and the whole community, the criminal justice system. The whole country is affected by this. And here's what's amazing. 60,000 people are going to die, and there are only 3 FDA-approved medicines to treat this condition. You compare that to cancer, infectious diseases, where there are dozens of medicines, there are only 3. And that's why the study that was announced last night was so important, because it shows that the medicines, A, are effective, B, they're equally effective, and C, we're not using them enough. And this is a really important tool for addressing the epidemic in the country.
What's the difference between Vivitrol and the other drugs? It's
a good question, because they're fundamentally different drugs philosophically. The drugs that were tested were Vivitrol, our drug, which is a medicine that blocks opioid receptors in the brain. It's given by injection once a month.
Once a month?
You go on Vivitrol after you've gone through detox, so you're drug-free. You get that injection once a month, and per the FDA label, it prevents relapse to opioid dependence. The other 2 medicines are actually replacement opioids. So you use these to keep people from sourcing street-based heroin or other illicit drugs. You replace them with medicines that themselves are opioids, but can be very medically useful because they keep people from getting in trouble from sourcing illicit drugs.
And here's the biggest issue with opioids. There was no controlled double-blind research, and there's still none that actually say opioids are effective for treating chronic pain over a period of years. So that's the biggest issue. We're getting people hooked, and there's no research, double-blind studies supporting this. But you have research, and you guys have 2 different studies. This study came out yesterday about how your product actually works for people that are addicted to opioids.
Correct. So the 2 studies you referred to, there was a study just about a month ago published in JAMA Psychiatry, a large study in Norway, which showed Suboxone versus Vivitrol, these 2 philosophically different approaches, and showed that they were equally effective. That was interesting. Now, the study last night, which was run by the National Institutes of Health, recapitulated those data in the U.S. and showed that Vivitrol was equally effective to Suboxone. But we really shouldn't be pitting one versus the other.
Right,
the point is, they're both effective, and patients should get access.
What does effective mean? You look at, what, 1,000 patients, few thousand patients. How many of them get over the problem?
Well, effectiveness within the context of a clinical trial is often defined for the statistical analysis. In this case, it was looking for how long people remain abstinent or drug-free during the course of the study. But it's a serious, chronic, difficult disease. And part of the findings of the study were not just that the medicines work well, but we're not doing a good enough job of keeping people on the medicine. So in my view, the time now is, let's put down the discussion about whether the drugs work or not, or which is better. They work equally well, and patients should get access to them. Now let's figure out a way to treat this epidemic in the country.
And that's my question, because as I understand it, Trump's administration is in favor of the kind of solution your company is offering. Not keeping people addicted to opioids, but getting them off it is what your drug does. Do you see the Trump administration giving a boost to your drugs, making them available to people who are fighting this?
Well, the president had a commission chaired by Governor Christie, as you know, the Opioid Commission, and their final report was issued on November 1st. And it's an excellent report. It's comprehensive about treatment and prevention and utilization of what we call medication-assisted treatment. So they're very much in favor of using new techniques to address the crisis.
And yours is once a month, and it's also non-habit forming, correct?
Well, it's the only medicine that doesn't have any addictive potential itself, because it blocks the opioid receptors and prevents the opioids from binding to those receptors in the brain.
So what happens? You take a painkiller, an opioid, and you get addicted, and then you're looking for that drug somewhere else, and some of these people have gone to heroin?
Correct.
Is that what happens?
So remember when Philip Seymour Hoffman, the actor, died here in New York, he had 70 bags of heroin in his apartment, and his kids waiting for him at the playground. The problem is that the street-based prescription opioids cost about $1 a milligram. So as you tolerize to opioids, they get more and more expensive. Heroin is incredibly cheap. A bag of heroin in New York is $5. And so once your addiction reaches the point where you need more and more, the easiest way to go is to buy heroin or fentanyl or carfentanil, the even more potent synthetic opioids that are flooding the streets now.
And God knows what they're cutting it up with. It's all, I mean, it's not
exactly.
It's terrible.
You really explained it so well, Richard. Thank you so much.
Well, thank you for having me.
We'll be watching the developments at Alkermes. Thank you. Richard Pops.